What harm can having too little of vitamin B12 do? Consider this: over the course of 2 months, a 62-year-old man developed numbness and a pins and needles sensation in his hands, had trouble walking, experienced severe joint pain, began turning yellow, and became progressively short of breath. The cause was lack of vitamin B12 in his bloodstream. Why vitamin B12 is important. The human body needs vitamin B12 to make red blood cells, nerves, DNA, and carry out other functions. The average adult should get 2.4 micrograms a day. Like most vitamins, B12 can't be made by the body. Instead, it must be gotten from food or supplements. And therein lies the problem. Some people don't consume enough vitamin B12 to meet their needs, while others can't absorb enough, no matter how much they take in. As a result, vitamin B12 deficiency is relatively common, especially among older people. Are you at risk of vitamin B12 deficiency? There are many causes for vitamin B12 deficiency. Surprisingly, 2 of them are practices often undertaken to improve health: a vegetarian diet and weight loss surgery. Plants don't make vitamin B12. The only foods that deliver it are meat, eggs, poultry, dairy products, and other foods from animals. Strict vegetarians and vegans are at high risk for developing a B12 deficiency if they don't eat grains that have been fortified with the vitamin or take a vitamin supplement. People who have weight loss surgery are also more likely to be low in vitamin B12 because the operation interferes with the body's ability to extract vitamin B12 from food. Conditions that interfere with nutrient absorption, such celiac or Crohn's disease, can cause B12 trouble. So can the use of commonly prescribed heartburn drugs, which reduce acid production in the stomach. Acid is needed to absorb vitamin B12. The condition is more likely to occur in older people due to the cutback in stomach acid production that often occurs with aging. Vitamin B12 deficiency symptoms. Vitamin B12 deficiency can be slow to develop, causing symptoms to appear gradually and intensify over time. It can also come on relatively quickly. Given the array of symptoms a vitamin B12 deficiency can cause, the condition can be overlooked or confused with something else. General physical symptoms of vitamin B12 deficiency can include feeling very tired or weak, experiencing nausea, vomiting or diarrhea, not feeling as hungry as usual, weight loss, having a sore mouth or tongue, having yellowish skin. Neurological symptoms of vitamin B12 deficiency can include numbness or tingling in your hands and feet, vision problems, having a hard time remembering things or getting confused easily, having a difficult time walking or speaking like you usually do. If neurological problems develop from vitamin B12 deficiency, they may not be reversible. Psychological symptoms of vitamin B12 deficiency can include feeling depressed, feeling irritable, experiencing a change in the way you feel and behave. While an experienced physician may notice the symptoms and be able to detect a vitamin B12 deficiency with a good interview and physical exam, a blood test is needed to confirm the condition. It's a good idea to ask your doctor about having your B12 level checked if you are a strict vegetarian or have had weight loss surgery or have a condition that interferes with the absorption of food. Early detection and treatment is important. If left untreated, the deficiency can cause severe neurologic problems and blood diseases. A serious vitamin B12 deficiency can be corrected 2 ways: weekly shots of vitamin B12 or daily high-dose B12 pills. A mild B12 deficiency can be corrected with a standard multivitamin. In many people, a vitamin B12 deficiency can be prevented. If you are a strict vegetarian or vegan, it's important to eat breads, cereals, or other grains that have been fortified with vitamin B12 or take a daily supplement. A standard multivitamin delivers 6 micrograms, more than enough to cover the average body's daily need. What causes vitamin B12 deficiency? Vitamin B12 deficiency happens if you are not eating enough vitamin B12 or your body is not absorbing the vitamin B12 you consume properly. Situations or conditions that can cause vitamin B12 deficiency include lack of vitamin B12 in your diet. People who don't eat enough foods that naturally have vitamin B12 or don't eat foods fortified with vitamin B12 can develop vitamin B12 deficiency. Gastritis. Gastritis is inflammation of the stomach lining, and it's a common cause of vitamin B12 deficiency. It can cause vitamin B12 deficiency due to a lack of hydrochloric acid in your stomach, which is needed for vitamin B12 absorption. Pernicious anemia. People who have pernicious anemia, a rare medical condition, are not able to make intrinsic factor, a protein made by your stomach. You need intrinsic factor so that your body can absorb B12 vitamin. People with pernicious anemia have a B12 vitamin deficiency. Digestive diseases. Diseases that affect the digestive system, like Crohn's disease and celiac disease, can prevent your body from fully absorbing vitamin B12. Surgery. People who have gastrointestinal surgery, such as a gastric bypass, weight loss surgery, can have difficulty absorbing vitamin B12. Alcohol use disorder. This condition can damage your digestive system and cause vitamin B12 deficiency. Transcobalamin 2 deficiency. This is a rare genetic disorder that impairs the transport of vitamin B12, also known as cobalamin, within the body. How can I prevent vitamin B12 deficiency? Most people can prevent vitamin B12 deficiency by consuming foods and drinks that have vitamin B12. Options for consuming vitamin B12 include animal food products. Red meat, fish, poultry, eggs, milk and other dairy products all contain vitamin B12. Fortified foods. Fortified foods are foods that have certain vitamins and nutrients added to them that they don't naturally have. Fortified foods include certain breakfast cereals, nutritional yeast, plant milk and certain bread. Be sure to check the food label, nutritional facts, to see if the food has been fortified with vitamin B12. Vitamin B12 dietary supplements. Many multivitamins have vitamin B12. There are also supplements that only have vitamin B12. Ask your healthcare provider or pharmacist to help you choose which supplement is best for you. Avoid alcohol. Frequent alcohol consumption can damage your digestive system and make it difficult for your body to absorb vitamin B12. Do your best to manage your digestive disease. If you have a digestive disease such as Crohn's disease or celiac disease, be sure to follow your healthcare provider's instructions to stay healthy. Let's end the video here. On the channel you can find many interesting videos about the benefits and harms of vegetables and fruits, as well as diseases and methods of treating them. Therefore, please do not forget to subscribe to the channel and click on the bell. I will also be grateful if you like and share the video with your family and friends. See you again.